Morning, I'm Dr. Duke Majan. Our patient here today we're doing surgery on is here for two degenerated discs, number 5-6 and 6-7 in the cervical spine. Cervical spine is the neck. We're going to be going in through the front, except we're not going to be doing a fusion. We're not going to be doing artificial discs. We're going to be doing an endoscopic surgery called the Duke laser disc repair. Everything will be done through a tiny 4mm incision. There's no need to put metal or plastic. This is the most advanced spine surgery in the world. It's being done at Duke Spine Institute. Other doctors are doing fusions, which is old-fashioned, and artificial discs, old-fashioned. These are highly invasive surgeries. We are performing less invasive, safer. All right. Right side, everyone agrees? Here we go. We've already done a Duke plasma rhizotomy earlier. We did not broadcast it because it's so quick and simple. And we're going to be broadcasting this DLDR. 2, 3, 4, 5, 6, 7. So I'm a little higher. Now what I'm doing is I'm using my fingers to displace, the trachea and esophagus. 2, 3, 4, 5, 6, 7. So that looks good. I'm going to go down to 6, 7, And then let's go in and AP, quick. I want to check my front back positioning of the needle. I want to make sure we're in the middle. That looks really good. Lateral. So we're going to go into 6, 7 first. Perfect. All right, that's a good start. Let's check AP again. You always want to check your front, back, and side x-rays. And we're using x-rays to navigate and localize. Perfect. You can see the spinous process. We're right in the middle. So I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute and pioneer of this novel technology, the Duke laser disc repair, as well as the Duke plasma rhizotomy. We made history yesterday. We did our first hip Duke plasma rhizotomy. This is a woman who had massive arthritis in her hip joint, couldn't even move her leg. She was in so much pain 24/7. When she left, she had 0 hip pain, 0. Completely went away. All right, very good. So you can see a huge tear in the back of the disc where the dye is leaking out. That's what we're here to fix. That tear is where her neck pain comes from. And that's where the herniation lives. We want to go get rid of the herniation. If you have questions, feel free to ask them. You can type them up and Sanjay will ask me, or Henry, whoever's working the mic today on our broadcast. We are broadcasting live. I don't know that I got too much in there. We're broadcasting live on Facebook, YouTube, LinkedIn, and Instagram. I guess, Twitter, which is now X. Looking good. I'm going to make my incision. This will be a 4mm incision. That's all you need to do the whole surgery endoscopically. I have people asking me, is the Duke laser disc repair procedure peer-reviewed and published? Absolutely. Our results have been peer-reviewed and published. The procedure has been peer-reviewed and published. And we've done over 1,700 of these surgeries now. We do about, well, now we're doing probably, at this rate, close to 500 a year. But we were doing about 100 a year. We've been doing it 17 years. And it's a very safe surgery. It's done under general anesthesia. All right, I'm going to count again. 2, 3, 4, 5, 6, 7. Everyone agree we're at 6, 7? All right. Now she has a very nice neck. You can actually see down C7-T1. I wish all my patients had this kind of a neck. Right? How is her airway? She has. What would cause that? Shot. And she has a lot of sensitivities. What's that? Yeah. Mallet. Shot. Any questions from our audience as we get started?
No current questions.
Huh?
No current questions.
Thanks. Is that what triggers it? Really? Tube goes in the carina. Carina. Why is the carina so sensitive? Shot? All right. Thank you. Let's do something different. Let me have the fluid adapter. I have an idea. Shot? Am I doing something wrong here? Little distraction. Shot? Yeah, it's much better. Yeah. Yeah, I can feel it going. That distraction is so important. I mean, I didn't even realize how important it was until we started to do it. Perfect. I like that. New technique. And we've got nice engagement. All right, if you have questions, feel free to ask them. The other thing about our surgery is it's relatively bloodless. We'll lose probably maybe 10 drops of blood, or maybe 20 at most. We've probably lost about 10 drops so far. And when you lose 20 drops of blood, you're losing just 1 cc or 1 milliliter. So it's bloodless surgery. Sanjay, do you have the video queued up for how does a herniated disc cause neck pain? We need the irrigation on, guys. Come on.
Yes, doctor.
Irrigation, please. Not on. Vai, Luis, vai.
It was me, Michael.
Well, at least you admit it. Hospital tendonitis. You need to go see. Yeah, you are. All right, welcome back. You can see that herniated disc cause symptoms through primarily inflammation, not compression. Look at that. There's fibers of the PLL right there. Pretty cool. This is the neuroforamen. We're zapping away the herniated disc. So that was it, 3 things, and you know, all 3 were orthopedic problems. I said, I'm going to send you a referral. No, I don't do the Medrol dose pack. I'm not going to put a diabetic on a Medrol dose pack. He's a diabetic, I think. He's big. Anyway. All right, if you have questions, feel free to answer. We're doing the Duke laser disc repair. You can actually see the dura down there. That's the spinal cord. And the nerve is coming off in the foramen here. I'm decompressing it. She's doing great. Let me flip. And she's got a nice neck. She's been kind to me, bringing me a nice neck. A nice long neck that's thin. She's given our anesthesiologist a fit because she's got some asthma apparently. Not now. She had some, but we treated it. So, any questions?
I believe that we have a comment or seeking advice from a Bailey on Facebook.
All right.
Bailey asked, they said, I am getting a lot of pinching in the back of my neck, both sides, and in the traps. When I press deep into my traps, it hurts heavy head, but I don't get numbness or pins or needles in the arms. Can it be a herniated disc?
It can be, but it's more likely facet joint pain. Facet joint pain. Please type that. F-A-C-E-T. And we can fix that very easily with a simple procedure called the Duke plasma rhizotomy. As a matter of fact, we just did one on this lady. See it all the time. It is totally fixable. What you need to do is do an MRI review with me, and Henry or Sanjay will type in the address for mrireview.dukespine.com so we can make a diagnosis. All right, so far everything's going well. You can see the laser fiber at 12 o'clock there on your screen. That is 0.5 millimeter, 0.5 millimeter wide. So that gives you an idea of how wide the tube is, right? The tube is not wide at all. Remember, the outside of the tube is 4 millimeters, so the inside is less than 4 millimeters. It's roughly 2.8 millimeters. And remember, the fiber there is 0.5 millimeter. So just to give you an idea of the sizes we're dealing with. But look at the view. That's the spinal cord right there. See the red thing? Those are veins on the side of the spinal cord. It's called the lateral sulcus. That's right where the nerve comes. And everything lateral to that is the nerve. That's the nerve in the neuroforamen. By the way, we did our first hip DPR, and I mentioned it earlier. I'm so excited. This patient needed a hip replacement. She didn't want it. So we did our Duke plasma rhizotomy for the hip. And you know what? Her pain was completely gone when she left. Incredible. And we did 4 little cuts. No, actually 3 little cuts on her abdomen and her thigh. And her hip pain is gone. She's not going to need that hip replacement anymore. This is going to be absolutely changing all of medicine and healthcare. The DPR, Duke plasma rhizotomy. Oh, look at that herniation there. So that's pretty scarred up. It's very, very hard. You see it, it's like a thick piece of plastic. And it doesn't want to come out. So I broke it up into little pieces, and now I'm taking them out. We float them out. The reason we can float these things out is there's irrigation, actually. You can't really see it, but you can kind of see things moving. And what that is irrigation. It's liquid, sterile liquid that we pass through these tubes that constantly clean out blood and pieces of disc herniation. See that thing? It's floating out. I'm literally taking it out and showing it the exit. I'm like a bouncer at a bar. You know, when you get a customer that you don't want there anymore. Anybody see the movie Roadhouse with Patrick Swayze? That's a classic film. I'll bet this patient has watched it. Roadhouse, Patrick Swayze. If you haven't seen it, go watch it. Boy, we have a bunch of uncultured people here. Has anybody here seen Roadhouse?
I have.
Oh, thank
I
God.
believe they're gonna create a new one.
Yeah. Anyway, when there's a bad guy, gal, whatever, these days, you show them the door. And I'm showing these herniated discs the door. So I'm just like Patrick Swayze. Right, Luis? All right. Almost done. You can see there's a little bit of scar tissue here. She's going to do fantastic. So happy for her. That's a bone spur. See, the visibility is so good. You can see far better with an endoscope than you can see with a microscope or loupes. A lot of surgeons do this surgery without any visual aids. I don't know how they do it because it's dangerous. You could easily cut the nerve if you're not careful. But using the endoscope, you could see every little detail. And you can avoid injuring anything important. This is all scar tissue. This is where the main herniation was. Little bone spur, scar tissue, it's all gone. We're done. Let me flip and see. I want to make sure I'm not leaving anything behind. Oh, there's one. We're going to get that guy right there. And then we'll be done. We're going to move on to the next disc, which is the number 5-6. Thank you. Any questions from our audience?
No current questions.
Great. Thanks, Sanjay. Well, since we don't have any questions, why don't we show the audience our video on how the Duke laser disc repair actually does its job. How does it work?
Copy that.
Traumatic injury on the disc can cause annular tears to. Disc herniations are a common cause of chronic neck pain.
Uh-huh, shot. All right. At this point, I'm at the back of this disc. Are you still doing 2, 3, 4, 5, 6? Yeah, we're fine. Shot. Looking good. Now we're going to bring our tube. Remember, the whole surgery is done with just this tube. So, you guys see this?
Yes, we do.
When we're looking through the endoscope, we're actually looking through the center of this tube. We're seeing the opening, and wherever the opening is, that's where the we want to put the opening in the annular tear, right where the herniation is at the back of the disc. That's where our tools are going to be doing their work. Everybody ready for a little distraction? Inline traction? Just a little. So, I'm going to advance this shot. Give me a little. Luis, you keep an eye on the dilator. A little more, guys. We're almost there. Yeah, I felt it go that time. One more shot, and we're done. I think we're done, yeah. That looks good. Thank you. Look at that, we're still engaged. It's beautiful. All right, we got probably 8 minutes left and we're done. Doctor, you want to start thinking about waking her up? Our next surgery today is going to be another cervical. It will be a single level in a gentleman who has a good size herniation at number, I think 4-5. 5-6 is the most common, yeah. All right, any questions from our audience?
No current questions.
So the nice thing about this surgery compared to a fusion, number one, we're not fusing. You're keeping your natural movement of your disc. Thank you. Number two, no big incision. Let me grab that out. Number three, no scar tissue, no bleeding, no metal plate in your neck, no loss of movement, no postoperative opioid painkillers needed, because we're not doing damage inside. We're literally pushing everything aside to get the tube in, but we're not cutting and slicing and dicing like a fusion does. Okay? You should see how much trauma is done during a fusion. Go watch one of my videos on YouTube. You'll see that you literally have to slice through tissues to get to the back where the disc is. And then you got to take the whole disc out in order to get to the herniation in the back of the disc. We're not doing any of that with this surgery. We're leaving the natural disc in place, letting it heal when we're done. And it will heal. These are all pieces of herniation. Grab her. Try to get him out. This is a very scarred up piece of herniation. That's why it's white and thick and hard. That's from chronic inflammation. Yep. That's a bone spur. That's the foramen where the nerve is. We just unpinched it with the laser. See how nice the view is? This is the best surgical view you're ever going to get. When surgeons do fusion, they can't see any of this. They just cannot. Remember, the laser fiber is 0.5 millimeter, 0.5. So all what you're seeing here is because of the endoscope. Without the endoscope, it's impossible. I use a microscope for my fusions. We have the best microscope in the world, a Zeiss NC5. And you can't get this view with the microscope, not even close. The endoscope gives you the best view of what's going on at the back of the disc. Look at all this scar tissue. Scar tissue and herniation right here. So much inflammation, it's created bone spurs, like this one. All right, I'm going to flip and go the other way. And what I do is I just flip back and forth. So I head one direction, clean out the herniation, then I head to the other. Any questions?
No current questions.
Everybody knows everything. All right, is the broadcast coming through?
Yes,
Remember
it is.
the last time we had that problem with no image or something?
Yeah, no, everything's working beautifully.
All right.
We're all systems are go.
Henry, you're amazing.
I appreciate it. Thank you.
Oh, look at that herniation there. You guys see it just wiggle its way out? Again, very dried up, no water left in that thing, completely dry. You see how I just kind of play like laser ping pong with it? And it gets smaller and smaller? That's because the laser is literally chopping pieces of it. And that's how you get them out. You just got to be patient. You know, some of the herniations are too big or too hard. They can't come out of the tube. So you just chop them until they're small enough they float out. Like this, okay? See how now I got rid of some of the mass? So it's less dense and it just floats out. I got less than 5 minutes left. All right, we got just 5 minutes left, and we're going to be taking this patient out of here and bringing our next patient back shortly. Like I said, our next patient, I'm not sure where he's from. Anybody know where the next patient's from? The single level cervical? Well, I thought it was interesting. This is Thursday. We operated Tuesday. We had two patients from Philadelphia, and we had one patient from Texas. We had a patient from Rwanda, Africa, and we had a patient from Ohio. Today we have patients from all over the country, and again we have global travelers as well. Everything okay, Berndes? You're huffing and puffing. All right, type up your questions for me. I'll come over there and answer them for you in about 5 minutes. I've already seen the next patient, marked them. We're already done our timeout, so we're good to go. I just want to get the last bit of this craggly material. Looking good. Everything looking good. Maybe that piece right there. Let's float it out. I don't see any more herniations, and everything has been cleaned up. Great job, everyone. Type your questions up. I'll come answer them for you. Great job, Luis. Great job, team. You guys are amazing. Let's try to get the room turned over, and let's try to get the next patient in ASAP. And Sanjay, go ahead and show our audience a nice patient testimonial from one of our prior patients.
Copy that.
Good morning, I'm Dr. Ara Duke-Majan, CEO and founder of the Duke Spine Institute, here with one of my patients who traveled from Mississippi.
Yes, sir. Oxford, Mississippi.
Oxford, Mississippi, which I've never been to Oxford, Mississippi, but I'm sure it's a lovely place.
Very nice.
And why did you come to Duke Spine Institute here in Florida?
I'm having issues with my lower back, shooting a pain all the way down towards my elbow, as well as having a little bit of stumbling while I'm walking within my left leg, and went to other physicians to look at my spine, whatever, and they wanted to do fusion and all kinds of other nonsense that I thought maybe there might be a simpler way, a process of doing things. Did a lot of research and found Dr. Duke here.
And what do we do for you?
You guys did a C3, I think 3, 4, 4, 5, 5, 6, at the Duke laser disc repair surgery.
And before surgery, you had neck pain?
Correct.
For how long?
It's been ongoing probably for about 5 years.
And then pain going from your neck into your right shoulder, down your right arm?
Correct, just getting progressively worse. And that's kind of what made me finally to say I got to definitely do something about it.
Here we are less than 24 hours after your surgery, the Duke laser disc repair. You can see the incision right here, it's 4 millimeters. And do you still have that neck pain and pain in your arm?
No, sir. Zero pain.
Gone.
Gone. Completely gone.
Cured.
In shock. Results better than I actually anticipated, which is a good thing, right? That's what I'm here for.
Well, I'm not shocked. It's what we expect to see typically, which is good. The procedure works, and that's why we do it. It works better than anything else. Were you offered any other treatments?
Yeah, they wanted me to go look at a, what do they call a spinal deformity doctor. And they possibly looked at like doing rods and pins and, and all that kind of good, the fusion and everything. So it just kind of...
Why didn't you want to do the fusion option?
Long time recovery time and just more of a difficult surgery.
Yeah.
Much more difficult surgery. And me working in a house, I still want to have good quality of life in the future.
Yeah. Well, fusions have complications, a lot of complications. Scar tissue, bleeding and pain. Are you having any pain right now from the surgery?
No, not at all. Just a little stiffness when I turn left to right, but that's par for the course.
Yeah, the stiffness is going to take some time to work out.
Sure.
You've had bad arthritis in your neck. Your discs were degenerated. You had degenerative disc disease and herniations and bone spur at C3-4, C4-5, C5-6. We went in and fixed all three. You will need therapy to increase the range of motion. It'll take time and you'll get better. Are you happy with your decision to come to Duke Spine Institute?
Very happy. I flew all the way down here from Oxford.
Yeah, very good.
So absolutely made the long trip. I fly back Saturday. And I feel much better flying on the plane than I did earlier. Just thinking, I'm not on any kind of pain medication, none of the muscle relaxant. There's zero pain, so I feel more comfortable hopping on that plane.
And we did it all through a 4mm incision. You could actually see the incision with the little tube going in to your discs. I moved the tube from one disc to the next, and we went back to the back of the disc where the tear was, and I cleaned the tears up with the laser. So that usually does the trick of getting rid of the neck pain when it comes from a herniated disc. And of course, we unpinched the nerve roots that were going down your arm. So that's why your arm is feeling better as well. I don't expect any of that to come back. You should be pain-free the rest of your life. Just don't re-injure the discs.
Absolutely. I'm definitely glad to get my quality of life back. That's the number one thing.
Anything you want to tell your audience?
Anybody that's dealing with the same issues I have, I definitely recommend to come to the Duke Institute of laser surgery. It's a wonderful thing.
All right. Well, congratulations.
Thank you so much. I appreciate it. Thank you so much. We will. Yeah. Well, my dad lives in Tampa, so my wife's up there in Oxford taking care of her stuff up there. So worked out good that I had my dad here to pick me up and drop me off at the airport tomorrow.
All right. Sounds good. Well, safe travels for you then.
Thank you so much. I sure appreciate it.
My pleasure.
2, 1.
Okay, I hope you enjoyed that testimonial as much as I did. So we've talked a little bit about what are we doing here with this surgery. And if you know anybody that has a herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, prolapsed disc, slipped disc, degenerated disc, basically it's all the same problem. It is a tear in the back of the disc where the herniation's coming out, causing inflammation and pain. And the treatment for it is traditionally for the last 80 years has been an ACDF. Surgeon goes through the front, makes a big cut in the neck, lots of scar tissue, lots of pain and suffering, swelling of the tissues, trauma from the surgery. Get down to the spine, take the discs out, and put in cages. You can see those cages there, and then a metal plate gets bolted. It's called an ACDF, anterior cervical discectomy and fusion. You might be able to see it better here. You can see the white cage right there, and you can see the metal plate, all right? The problem is you lose movement, and you have all the scar tissue, and you have trouble swallowing, and you have trouble with your voice for the rest of your life. It's different. Can't swallow normally ever again. It's basically 50% complication rate, 48% complication rate for ACDF. So that's what most doctors do. Why? It pays the best. It is the highest paying surgery you can do on the neck for a disc, a single disc herniation. So surgeons are just doing them left and right, trying to get paid, okay? Now, laser surgery is far better for the patient, not better for the surgeon, and not better for the hospital. So surgeons won't do laser surgery because A, they don't know how to do it, B, they don't have the equipment and training, and C, they get paid a heck of a lot less for doing laser surgery than they get paid for doing a fusion. So there's a lot of fusions being recommended out there, and that bothers me. Bothers me to the extent that I feel people need to know the truth, because fusions cause complications. I've done 1,000 of these fusions on the neck in my career. I'm guilty. However, when I did them because I didn't know how to do the endoscopic surgery, and I had to learn how to do that about 17 years ago from the Koreans. And of course, there was no reimbursement from the insurance companies, and still we struggle. And so a lot of people can't afford to do the laser. They end up doing what their insurance will pay for. If it's a fusion, that's what it is. So a lot of people get fusions because that's what their insurance company wants them to have. The insurance wants them to have that because a lot of people won't have fusions. Therefore, it's a deterrent. It's a natural deterrent. And it keeps the cost down for the carriers, the insurance carriers. But in the end, I feel there's an obligation to educate people about the truth. And the truth is there's now better surgeries than fusions and artificial discs that don't involve putting metal in your spine. They're safe. They're done with little cuts, no post-operative complications or issues. That's why we broadcast, and that's why we take questions. We want the public to know the truth. All right, what questions do we have, Sanjay?
We have a question from Loans by GW on YouTube. He says, my T10 will move around, severe deterioration. Do you replace or cage? How many options for severe deterioration?
So we have a question from somebody asking about T10. First of all, I don't know what they're talking about. T10 vertebral body or T10 disc. And if it's disc, it's got to be T1011 or T910. So really the best thing to do, number one, if you want to know my opinion about a problem you or somebody else has with your spine, your hip, your knee, your shoulder, we fix it all now at Duke Spine. Fill out the free MRI review. It's free. I mean, how many neurosurgeons are willing to come and spend 10 minutes with you, reviewing your MRI, talking to you, examining you, and figuring out what's wrong, and then telling you what's wrong and how to fix it, and then answering your questions? And that's what I do for free. And we do it virtually, so you don't even have to come to Duke Spine. We do that all the time. So just go to our free MRI review, mri.dukespine.com. I don't know what your problem is. I mean, your description is inaccurate and it doesn't paint the picture of what's wrong. I need to see it with my eyes, and I'd be happy to answer it for you.
No further questions?
All right, no further questions. We'll be back. We have a C4-5 Duke laser disc repair, herniated disc in a patient where the spinal cord is being crushed, and we're going to go in there and remove it with the laser. That's next.